Welcome back. The World Health Organization has long declared the climate crisis as the biggest threat to our health. Yet we don't often frame the climate change conversation around this particular issue.
Yeah, and that's why we are excited to have our next guest here with us. She is a physician and the president-elect of the Canadian Association of Physicians for the Environment. Please welcome to the show, Dr. Samantha Green. Welcome. Thank you. What a fascinating discussion. Okay, why do you think it's crucial for us to frame the climate crisis as a health crisis?
Yeah, so first, as you heard, it is the greatest health threat that we face, and we need to start thinking about it that way. And then secondly, there's academic research that shows that people are more likely to pay attention to climate change when it's framed as a health issue. There was a study of tens of thousands of people from a dozen countries around the world that showed that when it's framed as a health issue and when it's framed in a positive way, people are more likely to support action on climate change. And I think we also tend to tune out when we think of climate change as a polar bear problem or melting ice caps. But when we're really thinking about the health of our families and our communities, then we're more likely to pay attention.
That's a really interesting point, because when we talk about this conversation, it's always like on a global impact level, but let's go day to day. So in your practice, what are the impacts that you're seeing of the climate crisis on your patients, on the health issues that you're having to treat?
Yeah, I mean, first and most obviously, we see an increase in extreme heat. So I see patients who suffer from heat exhaustion, heat stroke, and also exacerbation of their chronic conditions when we're experiencing heat. And I see people who are more vulnerable also experiencing those conditions. So people who already have a chronic medical condition, or young people, old people, people who work outside and maybe more at risk. We also see the impact from wildfire smoke, especially in the West Coast, and we see impact from flooding, other extreme weather events such as hurricanes, drought, and then finally we're seeing an increase in infectious diseases. So right now I can diagnose Lyme disease that someone may have contracted in downtown Toronto, and that was never the case before. And then globally, there's also a link between climate change and pandemics. So unfortunately, we may see future pandemics as a result of climate change.
And how about pollution? You mentioned the wildfires, but what about other elements in the air that are affecting health?
Yeah, so air pollution is a silent killer that no one wants to talk about. It's responsible for 1 in 5 deaths worldwide and 1 in 7 premature deaths here in Canada. So there are many reasons that tell us that we need to stop burning fossil fuels. So when we're burning fossil fuels, we're creating that air pollution and that air pollution-related disease and death. And when we're burning air pollution, we're also causing global climate change.
Whoa, those are staggering statistics. Like, I'm just processing that. Those are immensely, profound physical health concerns, but there's also mental health concerns as well. So what have you noticed on that front?
Yeah, I mean, if you've been through an extreme weather event such as a flood, or if you've had damage to your house in a hurricane, of course there are significant mental health impacts, especially on children. And during extreme heat, people also experience increased anxiety and increased depression. And people with serious mental illness also can see a worsening of their mental illness during an extreme weather event. So for example, during the 2021 BC heat dome event, people living with schizophrenia were actually 5 times more likely to die than the average person in British Columbia.
Wow. So right now, who would you say is currently most susceptible to the impacts of climate change?
Currently, I think people who are already vulnerable or marginalized, so people living in poverty, people experiencing homelessness, also people who work outdoors. I think we often don't think about, say, construction workers, small children, and the elderly. And I think ultimately, all of us, our health will be affected in our lifetimes by the climate crisis.
We should note that people in the global south have been struggling with changes in the climate for a long, long time. So here in Canada, how are our issues expected to evolve over time as the climate crisis worsens?
So yeah, we're currently at about 1.2 degrees of warming, and the latest report from the Intergovernmental Panel on Climate Change says we will most likely hit 1.5 degrees in the coming decades. And so we will see an increase in extreme weather events here in Canada. Even if we were to stop burning fossil fuels today, which we should, we would still see that increased temperature up until 2040, 2050, when it would peak and come down. And I would say also, we do need to be thinking about the global south, you know? Although it feels far away, there's an ethical question there when we're thinking about the fossil fuels that we're burning here in Canada.
Mm-hmm. And how it's impacting the rest of the world, for sure. So as these climate-related illnesses increase, does it change the way that you treat patients as a result?
Yeah, I mean, we're starting to teach it more in health professional curriculum in medical schools, and we do need to provide our patients with some better anticipatory guidance. So talk to our patients about medications that might put them at risk of heat exhaustion, for example, like blood pressure pills, allergy pills, antidepressants. Those all affect someone's ability to regulate their body temperature. And so we should be advising our patients about that. Really even providing inhalers to patients who experience asthma in advance of a forest fire, in advance of forest fire season. And I'll just add one additional thing is I'm engaged in advocacy around climate change because of the health impacts that I'm seeing in my day-to-day practice.
So let's talk about what you like to discuss called the co-benefits of climate action. These are things that help the planet, but also help our health. So what are some of those? Leave us with some hope, Doc.
Yes, of course.
Yeah.
We should talk more about solutions. So the top three things that are beneficial for both the planet and for our own health, I advise my patients to think about adopting a plant-rich diet. So more meals that do not include meat, that's good for the planet. And it's also linked with improved heart health, decreased risk of diabetes, improved cardiovascular health. And then I also advise my patients to engage in active transportation, so walking and biking more for your errands, because that is independently linked with decreased mortality, decreased risk of heart disease, and of course it's also decreased emissions from driving. And then finally, spending more time in nature. Spending at least 2 hours a week in nature, 20 minutes at a time, is linked with improved mental and physical health. It also, when we have more green space, it actually cools the earth. So green spaces are up to 12 degrees cooler than surrounding areas. And then people who engage in nature are also more likely to take pro-climate, pro-nature behavior.
Dr. Green, thank you so much for your advocacy and your wisdom. You gave us a lot to think about today. We really appreciate it.
Hey there, wasn't that great? Do you know where you can find some equally good content? Our YouTube page. It's filled with discussions, debates, and some laughs. Head there now, like and subscribe.